I started my career as a teacher, as a student from school days to college days. I was interested in drawing also, painting. I started my earlier career in film line, I used to work with V. Shantaram as a set designer. I was supposed to be a very bright student at those days. That's why I became a teacher. For 3 years I stayed there. And after that I shifted to advertising. Yeah, in those days, normally in advertising, after hours working habit is there. That after my work, while I was climbing stairs to my house, it happened that I couldn't lift my leg. I didn't have that feeling that I'm having a stroke, but I had feeling that I cannot lift my leg. But next morning, again the same thing, I couldn't lift my leg or even my body. And even then I didn't realize that it is a stroke, it's a paralysis attack. And we didn't realize that I have this stroke and I had to move to somewhere, to hospital. So one day, after trying out this all nonsense, 3-4 days, my wife, my kids, they forced me to go to a hospital where I met Dr. Hastak for the first time. Those days, the importance of the time factor was not there. That awareness was not there at all. But Dr. Hastak told me that the thing doing is, we will wait for 6 months. When the doctor said, whatever has to happen has happened, there is no other medicine, that nothing can be improved, that's the period, end of it. Then I said, why? There has to be something else. Why not try that? That is how when somebody says, no, you can't, it's dead end, that challenges me, my ego. That is how I started taking this alternative help. But unfortunately, I just don't blame those, whatever these therapies and logic they have. Because basically the whole mistake was from my side. I should have attained, taken care of my health properly, gone to proper doctor, gone to hospital in the nick of time. Basically, it is due to Dr. Hastak, which have forced me to do something. I could divert my attention from my physical problem into something. That is how I started doing painting. Because what had happened, I'm a right-handed person. I've always been a right-handed person. It was very difficult for me. Almost 3 years I had to struggle. Of course, even in those days, other doctors have helped me to how to get hold of meaning converting my right hand to left hand. Almost 3 years I struggled. And one day I couldn't make it.
He basically had taken some alternative medicine for his first stroke, and had recovered in 2 to 3 days. The next time he got a stroke and his right hand and leg became weak, he again searched for that alternative medicine doctor who was out of town, and he was not treated in time, and he came to me with an established stroke. After this, I did encourage him to start using his left hand and leg and to prevent his next stroke. He was, mind you, a right-handed painter, and he started using his left hand for painting. And he did his first painting, I believe, sometime in 2006-07, and then he did 23 paintings showing the story of stroke and his struggle against stroke. And following that, I believe till today he has done about 400 to 500 paintings. The symptoms of stroke are complex, and so a person or a patient cannot understand that his loss of speech is from his brain, or his loss of hand function is from his brain. Usually he will assume that there is a local problem there. And to understand that the brain, which is a long distance connection to your hand, is the real cause of your hand weakness. So our ability to deliver quality care to patients in time is based on creating awareness amongst people. And this awareness can be created by what is called as FAST, the face, arm, speech time, which is if you lose your face activity, you may have a stroke, or if you suddenly lose your speech, you may have a stroke, or if you suddenly lose your arm and leg activity, you may have a stroke. And you have to rush such patients to the hospital in time, because if you don't rush them within 4.5 hours, you are likely to lose brain permanently. And I think this is the real awareness we want to create, and we want to create a quality parameter of treating stroke patients in time by looking at the door to what is called as the door to needle time or the door to treatment time. I would say that ultimately life wins, and life wins when we transform negativity into a positivity, and that's what Wockhardt is all about.
Life wins. We win.
New Age Wockhardt Hospitals. Life wins.